So it's preparing to stream, but we should be live and you are all being recorded. So just bear with me a minute. Once it's a final setup, I'll give you a go, Glenn, to open the meeting. Okay. Okay, Glenn, we are good to go. Mr.
All
Chair.
right. Well, it's, let's see, just about 6 o'clock. We'll call this meeting to order on Tuesday. Where are we? April 13th, 2021. So we'll start, open the meeting with a roll call and find out who's here. So after I say your name, say present, please. We've got Dr. Jane.
Present.
Dr. Sane.
Present.
Attorney Capabianco is not joining us this evening. And I'm Glenn French. We have our health agent, Kristen Black, leading the way. So with that in mind, we'll turn it over to Kristen and she can read us the riot act.
So I'll go through this is our script, which is for remote meetings. So this open meeting of the Northborough Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. All members of the Board of Health are allowed and encouraged to participate remotely. The order allows the Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to the Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So I'll hand it back to you, Mr. Chair.
Okay, who's taking the minutes this evening? Is that Ms. Holt?
I'm here, yep.
Hello.
Hi.
You want to get to? Okay, well, I don't have the agenda in front of me, but I'm going to guess the first thing on the list is any past news or new news that needs to be brought to the board's attention. So I'll turn it back over to Ms. Black.
Actually, I'm just pulling up the agenda as well. Katie, are we first voting minutes on the agenda? I'll just pull that. Can you walk us through the agenda?
Yep, the first item is the meeting minutes reviews from March 9th.
Okay. I've reviewed them. Has everyone else on the board had a chance
Yes.
to look at them?
Yes.
Does anyone on the board have any comments, concerns, issues, or changes to be made?
No.
No.
Then I move as chairman of the board to approve the minutes from March 9th, was it? 2021 as written.
Second it.
All those in favor? Oh, I know what you do. Dr. Jane, you're in
Aye.
favor?
Yes.
Dr. Sane, in favor?
Yes.
And I'm in favor. It's unanimous. They're recorded for all posterity. Next item on the agenda.
Okay, so next up is our case count or COVID-19 update. So briefly, just to go over case counts. This week we're seeing just, our rates have dropped slightly from where we were, the prior reporting week. One thing we haven't solved yet is the state, the state, I want to say, did change the way they're producing that weekly public health report. So you're not going to see that great report with all the town data, like in that summary table. So now you sort of have to fish around the dashboard that's on the state's reporting tool. And you can select some of the raw data there. So Our town clerk, Andy's been great. He's going to take over the posting the graphic each week now that we're transitioning to this regional site. So you're just going to see the graphic, which is just, summary numbers that will be posted each week to the town's website. So that has our total case count. So we definitely have seen a bit of an uptick in cases in younger ages. I think we had like 50% of the cases reported in that previous period were all ages 30 and under. So it's definitely, we're seeing that shift. And we've definitely seen more cases, but no evidence so far of any transmission in the schools, which is great news. So the schools are open and things are working there, but I think we're just seeing, people are sort of loosening up, letting their guard down a bit. And we're seeing more, social gatherings and play dates and other things like that, and more outdoor activities and things that have brought people in closer proximity. As things are opening up a bit. So overall, again, we're still working with Salmon VNA, is still doing our contact tracing. We have a new nurse, Jessica Mendel, that's really been assigned and dedicated just to the town of Northborough. So very few cases are being referred currently to the CTC, but there is that steady flow of work. So I don't know if you have any questions specific to case counts. I can move on to the regional clinic.
No, I don't have any.
No questions.
Other than,
Yeah.
I am impressed about the school and the non-transmission between the students. It's an anomaly, if you ask me. Any comments, concerns about that, or, how do they explain these things?
Well, I think, that 3 to 6 feet really does work, and they're wearing masks. And I like to think, I have my own kids. They follow the rules at school, right? It's after school when they're with their masks off and hanging out with their friends and sitting around, playing video game, whatever they may do. In school, they have great protocols in place and they're following through. And I think that's the evidence of the success. We know how the disease is spread or the illness is spread, and the protective measures become very effective, across the country. And we're seeing pretty good trends with the schools overall. So the high school, I think they're preparing for their opening around April 26th. So that's the only school that's not back full time, but they are still moving ahead. We have seen other communities in Massachusetts, postpone or delay, that have seen upticks, in cases and evidence of in-school transmission. But the medical advisory team is watching that very closely. The schools, contact tracing is taking place. And again, we still don't have any evidence of, transmission in the schools. And they do have a very robust testing or screening program that will continue. So free testing is offered once a week to all of the Northborough students. And it's a nasal swab kit that they administer at home. And that is pooled testing that's being done once a week. So that's also helping to detect cases and slow the spread in our community.
Interesting. Now, I remember when the COVID was really taking off, the first thing that I think the CDC said was that kids aren't really susceptible to this disease and they can't really catch it and they don't really transmit it. Has that changed? Have they determined if kids can actually get it and transmit it and all that? Or is it really, they have some sort of built-in, not immunity, but some sort of way to fight it off? Does anyone know?
I think, well, I don't know. Other medical doctors, I'll leave it to you, but I think early on they definitely said that children are not as effective as transmitting it as adults, but they can transmit the virus, right? So we're seeing higher cases that, once you're in your teens, they spread it as equally at the same rate as adults. So there are those younger ages where we see lower rates of transmission, but it doesn't mean they can't transmit. It's just, I don't know.
Yeah.
Dr. Sani, Dr. Jane, you want to comment?
Yeah, like little kids.
No, kids are getting it, whether it's in preschools or elementary schools, and they are spreading it, but not within the schools. It's more of other places of contact. So the schools are doing, as Kristen mentioned earlier, they're doing a great job in terms of, making sure the kids are wearing the mask, good hand washing, maintaining the 6 feet. We find the parents are not as good as the kids are.
Right.
Frankly, but yeah, kids are getting it, but it's much milder.
Yeah.
I think now that the variant is going around, that's the more contagious one.
Right.
And
the
for
youth
and for
variant.
younger populations, and for
For
the younger
younger, yeah,
populations.
for
That's
the
the problem.
teens too. Yeah, yeah.
Now, if an adult catches it from, let's say, a 4-year-old,
Mhm.
could they develop the same like terribleness COVID, or is it a lesser sort of
No, they could develop
sickness?
they could develop the full-blown COVID.
So
You
the
know?
little buggers could give it to you, and then you're really in trouble.
Yeah, so I mean, the younger population can be carriers without even symptoms.
Right.
And when they go and meet grandma, grandpa, and older uncles and aunts who have underlying, of course, the same risk factors are there. So the more risk factors you have, the more you're at risk. And the vaccination helps, but that's why they're telling you to still wear the mask.
Forever and ever, Doc?
Well, again, so the new CDC guidelines, right? If you're having a get together in your home and if everyone has been vaccinated, you do not have to wear the mask.
Right.
But everyone needs to be vaccinated. So are you going to be asking all of your friends to bring their vaccination card so you can see that, or are you going to trust them to say, oh, I've gotten vaccinated? And while one dose of the vaccine gives you effectively about a 70% protection, 2 doses, gives you the 95%, but that still leaves 5 to 6%
Right.
not being covered. So the choice is yours, right? I mean, as long as you know that, then the question is, should you be wearing a mask all the time? Should you socially distance all the time? Until we get further out into this, that's probably for the foreseeable future, especially when we get to more normal, kids back in school full time, people going back to work at the office again. I think until that time, I think on the planes, traveling, I don't think that's going to go away for quite some time, no matter how much the airlines try to reassure us. And the other thing, and unless Swati knows something different, is we got this vaccine. So is it like a traditional flu shot that annually you're going to have to get something? Are they going to commingle it with the flu and add the strain into the flu shot, so we have only one shot at that time? If you go back, 10 years ago or 12 years ago, when we had that H1N1 that came through, we had an emergency production of a second flu vaccine in the spring, so that we could get everyone hooked onto the H1N1 at that time. But now they've incorporated into the flu shot, so they may add the COVID in there too. Who knows, to make it just one shot again, going forward. So time will tell.
Yeah, I think it will be a recurrent, just like the flu.
I have a feeling it will be
Those
too.
who have been vaccinated in December, I think now they can start, in late spring or summer testing for antibodies. If they're still present, they're waned, and if they need repeat shots every fall, every winter. Yeah. So.
Yeah.
But the masks are, I think, here to stay, at least for the next couple of years.
Yeah.
Wow.
And once the virulence goes down, once the virus is not as virulent, I think in 2024, 25, it's just around any other, cold virus, then things will get back to how they were before.
I mean, you're seeing upticks all over the world, right? I mean, India right now is a nightmare. They've gone on lockdown for 2 months in one state, in Mumbai and Pune. Lockdown for the next 2 weeks, starting tomorrow evening at 8 o'clock. And the number of cases have picked up. In Europe, it's picked up. Brazil, it's picked up. So.
Yeah, I guess.
Yeah.
Well, it's scary. So I'm thinking like Easter, there are a bunch of little kids running around, little goblins.
Yep.
Oh, man. All right. Okay.
Well, I
Sorry
can jump.
asked. I'm glad I asked, but I'm sorry I asked.
Yeah, now that we're all sad about wearing masks for,
Oh my God.
foreseeable, we'll transition to good. So I can jump in on the regional vaccination clinic. So our last local one will be held this Friday. We have, it's a second dose clinic, and we're just following up with 110 individuals that we vaccinated, 4 weeks prior. So that will mark the end of our local Northborough clinic at the senior center. So we'll be breaking down all of our supplies, and hopefully the senior center will be reopening with activities, which is really, rewarding to see, additional opportunities available for seniors. And we're pushing our efforts over to the DoubleTree Westboro, and that's right off of Computer Drive in Westboro. So that's site. We're officially opening. We received vaccine on Friday from the state of Massachusetts, 1,500 doses of Moderna, and we will be administering those doses Wednesday through Friday of this week. It has been a monumental task and effort, and a real, amazing challenge and great working environment to coordinate with 7 other communities and our colleagues, fire departments and health departments, and town administrator's office. And it's been a great effort of everybody coming together with supplies and staff. The town of Northborough is that we are the lead. We are the ones ordering the vaccine. We are paying the big, rental fee to the DoubleTree, which, don't worry, everybody, it's fully reimbursable through FEMA. And so all the costs of the vaccine that we talk about, any of this staffing costs, supplies, paying fire department overtime, et cetera, all of that is covered 100% under FEMA. And there'll be a process for that to be reimbursed. But the town of Northborough, our main role is we are the ordering provider. So that's going through the Northborough Board of Health. So your MIIS account is what we're using to order the vaccine. And it will now, starting next week, start to be delivered directly to the DoubleTree. We have a hired site coordinator. His name is Brian Roberts. He was recently retired captain for the Westboro Fire Department. And he's also has experience working in federal government on disaster emergency response. So I don't think we could have a more cool, calm, collected, and experienced site coordinator there. And he's easygoing and the perfect personality to really manage this well. And so he understands, burn rates on PPE and staffing and credentialing, and he's really is a great person to fit in this role. So he was hired by the town of Westboro and the other 6 communities, because we're bearing the burden of the big rental fee and my time and the health department's time. The other 6 communities are also all hiring or have already hired 1 or 2 clerical positions that will work the clinic. So Katie and Angie from our health department don't have to sit there 3 days a week and run a registration desk. So there are, I think, again, there's going to be somewhere between like 6 to 9 clerical individuals hired that will be able to work at that clinic full time and support Brian, and also support Brian not just during the hours of the clinic, but after, breaking things down, ordering, and also, over time, probably helping people schedule or helping to get those links out. So just to recap, so we local clinics were shut down and we were sort of forced into this model. So again, it's 7 town communities. 75% of the doses we receive, our total allocation, 75% is automatically going through the state's pre-registration system. Our number 1, the best way to get an appointment at the site is to pre-register, and that's on all of our town documents, as we're pushing things out, press releases. And so
there's a link. I'm sorry, Kristen, there's a link there. Okay.
Yeah, there's a link to pre-register. I mean, if you go on mass.gov/vaccine, the first thing you hit is pre-register. So you just put in your information, and you'll be notified when an appointment's available sort of in your area when you're next in line. So they'll consider, your category, your age, you have to answer if you have 1 or more medical conditions. They sort of factor all that in, and they work down the list. So that's sort of a state Google notification system, but it's linked to our site, and it's also linked to other new regional collaboratives in the mass vaccination site. So if you were to get an email because you were next in line on the state system, it would say you have 24 hours. Here are the available locations and appointment times, and people will have choices. So the reason why we're offering this clinic is you'll hear from I'm starting to hear from people, I want the vaccine, but I don't want to go very far. So I think a big benefit we have here is those people in town that get that notice, that pre-register, maybe if it just said Gillette, they wouldn't do it. But if hopefully it's going to say Westboro, and they're going to say, well, that's pretty convenient, I'll go book that appointment. And the remaining 25% of our doses will be distributed through private links. So we take the 25%, we divide it by 7 towns. So this week, for example, we had approximately 60 appointments, and they were sent out through our town news. And also we have that constant contact sign-up list that a lot of people signed up to be notified about COVID vaccine appointments. And so the health department manages that. So I think we have over 2,000 people who have, signed up for those notifications.
Wow.
So they all received it. The appointments did go quickly. I know people get frustrated. They get the notice and they try to book. Luckily, it's not a big lift. You only have to click through 2 screens to realize there's no more appointments. So that the problems we've heard hold on 1 minute, nothing about, okay. Yeah. Okay, sorry guys, real life, So anyway, when the links are going live, so there's a Town of Northborough link, and I'll have a heads up because I'll be the one adding the appointment. So what we'll try to do to our residents, try to notify them is we can use that distribution list to let them know when the appointments are released. So think of it like CVS, right? Everybody's heard of friends booking on CVS, and just sit there all day, and at 12 at night and I hit refresh and eventually something pops up. It's really the same system. The link is the link. It's not going to change week to week, but we will push out notifications to Town of Northborough residents to say, the appointments were now released, or they'll be released Friday at 12:20, so if we can give you a heads up. And we hope to have more appointments over time. And so that's the 25%. And then there's cancellations that are going to happen. No shows are going to happen. And many of you have heard there's a lot of, you end up with extra doses. So the state gives us, for the 1,500 doses, we have, the vials, and the vials should have 10 doses each. That's the 1,500. But we often, with Moderna, they're starting to overfill. It's very customary. We receive at least 1 extra dose per vial. I've seen vials where we've had 3 extra doses, but we typically see 1. So we have about 10% of extra doses that we'll also distribute through that town link. And also I just set up a link that will be pushed out, a call list. So we also want to maintain a local list of people to call. And so it's very simple. You just put your name. And at this point, everyone's eligible on the 19th, next Monday. So that doesn't really matter,
Right.
and then we'll just put your name and we'll call you. So we just need to know that you'll be available to answer the phone during those times. And we're not going to leave messages because, when we have a cancellation, we need to fill it right away. So it's all explained in the sign up, and we'll encourage people to, consider signing up. If you're in town, you work in town, and you can pick what days of the week you're often available. So if you don't work on Friday and that's a day that, you could just, answer your phone and come by, then you can check off Friday. So we'll be using that as one of the tools to help get our residents and employees in town vaccinated at our local clinic.
Do you anticipate 1,500 a week going forward?
Yep. So the state, great question. The state has said yes, through the end of the month, they're guaranteeing 1,500 a week. That's why they had sort of delayed on these clinics. They wanted to have the guaranteed supply. Obviously with the Johnson & Johnson news, that's tough. So they had hoped to increase, but that's not going to really happen because of the updates with the J&J vaccine, but we will see 1,500 a week. So all the way through the end of the month or May 1. So 3 weeks at 1,500. Obviously, we're going to have second doses that come online. So the plan then is we'd be doubled up, I'm hoping. So we'd be doing 1,500 new, 1,500 second. I mean, we definitely have the capacity. We'll be really testing that out and figuring out our throughput on Wednesday. We're right now booked our first day. It's 5 hours of vaccinating. We're running 9 to 2. And we're going to try to, just start slow on our first day, about 84 individuals an hour. We're going to run 10 vaccinators. And then we're going to really ramp that up. And by the afternoons on our day 2 and day 3, we'll be doing about 120 an hour is our projected throughput. So we'll see and play around with those numbers. We want to make sure it's efficient. People aren't waiting. They can socially distance. So we'll be making adjustments as needed, adding or subtracting staff. Right now we're seeing about our staffing model is about 33 individuals per shift. There's really 3 pools of people we're pulling from. First is the paramedics. Across the 7 communities, we have volunteer full-time staff. They're pulling overtime shifts. They sign up for the shifts, and each town contributes to that pool. We have over 140 trained vaccinators between all of our fire departments, which is a great big pool. Hopefully they enjoy the overtime, and they've been fabulous at our clinics and really great with the public. So they'll be filling our vaccinators and our observers in the observation room. So if anyone were to have a reaction, we have trained medical staff to respond. And then the other 2 pools, we are filling sort of the greeter roles and exit, and some of the assistance with people are being filled by CERT and MRC. We may pull in MRC members in the future for vaccinator positions, but not in our first week or 2. And then the third pool is we're really pulling on these clerical positions that were hired, and also health department and other town staff to help staff, sort of the check-in process. We'll be using the state's color registration software, which is totally paperless. But you're going to come in, you'll show your photo ID, they check you in, and you'll be moving through this whole process paperless, and the vaccinators will actually go through all the pre-screening questions, and they'll enter the outcome immediately on the spot when you're vaccinated. And if you signed up with a phone or an email, you'll get pinged right away to schedule your second appointment as you walk out of the vaccination room. So while you're sitting for 15 minutes in the observation room, it's very simple. And we'll also have 3 second dose scheduling desks set up to walk anybody through that maybe doesn't have that technology or just needs a helpful hand. So by the time they walk out the door, their second dose is scheduled. So we're hoping it's going to be really efficient, and welcome all the board members to come by and check it out so you can see firsthand. We did do a walkthrough with town staff this morning, but we're up and running. So come visit us, board members, and we'll go from there. So unfortunately, we can't entertain lots of visitors from the public. Obviously, this is a fish machine, but we hope we'll be welcoming members of the public for their vaccination shot. So look for those methods, and if people are really struggling to register, or you can always send us an email at the BOH town.northborough.ma.us or call the Board of Health, and we're happy to help you with that process. So
it's next Wednesday, 9 to 2 at the DoubleTree. Tomorrow
we're starting. Yeah, that's why I might look a little tired. I was there late last night. Okay. So we'll officially start tomorrow. Staff are meeting at 8 for a brief orientation. We'll start with the vaccinations at 9. So it's 9 to 2 on Wednesday and Thursday, and Friday's just a little longer. We're going to run that 9 to 3.
Oh.
A couple of questions, Kristen. So do we have a refrigerator or a freezer there, or do we have to buy it or rent it or whatever it is? Is it going to be staying on site at DoubleTree where all the vaccinations are going to be held there until they're used up, and then the next week and whatever?
Yeah. So we have a pharmaceutical grade refrigerator. It's actually the town of Westboro. So they had it on site for their clinics that they were running at the location. So it's still there. So it's all like on file with the state. There's a data logger, so we have great system there. And so we don't have a need for a freezer, but if we do, the town of Westboro has a pharmaceutical grade freezer that can hold the Pfizer vaccine for, I forget if it's 14 or 30 days. So we have that equipment between the shared towns. So it'll be a matter of moving it. Our small pharmaceutical grade refrigerator that's at the Northborough Senior Center now will be moved after our clinic just to have a backup. It's also a newer locking system, which is great. So again, we're all set, luckily, on storage and handling, and we had purchased one for our clinic, so we'll be able to transition.
Excellent. And do you have any idea what the vaccination rate is amongst our teachers in town?
I literally, and I can't speak to how many. I know they had great acceptance. I want to say the number I heard from the superintendent was like 97% of teachers wanted the vaccine, which is phenomenal. It's great. I can tell you that I've gone through list after list. Every week we have a clinic. We try to get more teachers in. Do you have anybody? I think I found 2 came through the cracks, like today with Mary Ellen Duggan, our wellness coordinator, and we're helping. But as far as I know, all teachers in both Northborough, Southborough districts have been I don't want to say fully vaccinated, have all had at least their first dose.
Okay.
Supported them, and I haven't heard of any issues with any teachers. I mean, just at our clinic, it wasn't last Friday, but the Friday before, we were able to grab the 3 remaining teachers or staff on site that we're still looking for the vaccine. So our school district is in great shape. Mostly the efforts of different people. I heard there was a woman on maternity leave, a teacher who was helping to schedule others. They really crowdsourced or, really came together to register other individuals who weren't so savvy. So we are in great shape. Same thing with municipal employees, DPW workers, et cetera. We've really, with our local clinics, we're able to keep up with all of that. And so I think our staff are great. Even at our last clinic last Friday, we had some extra doses and we need to get them out. And we called a restaurant and a hardware store and said, send us your retail workers, right? They were eligible at that time. So we'll continue as we have more spots available to work with our local businesses, to help any other staff members that would need vaccination. But the schools are in great shape.
Good news. Great news.
And that included even the substitute teachers?
Yeah, that's a good question. I think they were offering it to all. I mean, they're in the building, so they were staff. So, I mean, if you hear of any, we want to vaccinate all teachers, so it doesn't matter substitute or not. But yeah, as far as I know. And we'll also, I just sent to Mary Ellen that sort of drop down call list for anybody with those last minute doses. So, you know, if we did miss them, or some people have been waiting and want to wait till they're comfortable, you know, we'll be able to still help them and get them in locally.
But what about the daycare workers?
Yeah, we've been
They're
vaccinating
the
a bunch
ones.
of them. Yeah, a lot of daycare
Been
workers.
sticking with the theme for the evening.
Yeah,
My goodness. Okay. Good.
great. So do you guys have any other?
You never sleep, do you, Kristen?
No,
My God.
really well.
It's going well, though. It sounds fantastic. It's a great job. Perfect.
Yeah.
Yeah, I
well-
mean, kudos to the team, I swear.
Yeah.
So we can actually, one request I'm going to throw out while I have Dr. Jane, Dr. Sani. So Dr. Ulrich is on the Westboro Board of Health. I believe he may be their chair. And he's serving sort of, I know he'll be there the first day of the clinic, and he's supported them with their clinic. We don't have too many questions, but, you know, sometimes there's a question about someone, you know, and it's nice to have a medical doctor or physician on call. And so we're not expected to have a physician or a medical director there every day. The Westboro Fire Department also has a medical director on call 24/7. But I didn't know, Dr. Jane and Dr. Sane, if we could add you to our drop-down call list. So if we ever did need to put a call in, you know, with any questions about the vaccine or anything like that, if you'd be available or open to that.
Yes, I mean, I would be unless I'm in a meeting. I totally am. So, I mean, I'm working from home anytime.
I'm in the clinic except for Wednesdays. All the other days I'm in the clinic, 8 to 6. But, you know, you could add me on, and, you know, I can let my nurse know if the, you know, phone rings and it looks like it's a 393 number to answer it. Sure.
Okay, great. Thank you very much.
Do you need our contact information? Our phone
think I-
numbers?
I think,
You have
Katie,
it?
you have it from the emergency, all of our emergency
Preparedness-
lists and
preparedness
drills.
stuff. Okay. All
But
right.
we can confirm that. Yeah. So we'll try to put something together. Maybe you can help me with that, Katie. And we'll get that out. So thank you. But okay. So any other questions on regional clinic?
Nope.
No?
All right. So the next big update is the public health. I have to find it. It's a big long grant title. So it's the Public Health Excellence Grant Program for Shared Services. So you all received multiple emails with lots of documents, and I just want to give you a brief overview. I also was invited last night. I was on the Board of Selectmen meeting, so some of the public may have, you know, heard the spiel on it. But ultimately, the application was due on April 1st. So I'm sorry we didn't have lots of Board of Health meetings to talk about the concept. So, you know, we haven't officially, the Board of Health doesn't need to make a vote or do anything official. So the application is due on the 1st. We're actually going to hear tomorrow if we get it.
Oh,
And so
exciting.
yeah, so we quickly
Yes.
pulled together a meeting. So the way it works with this Public Health Excellence Grant, first I want to say it's historical. We've never seen grant money like this in local public health. It's $300,000 per year for 3 years with an extension for a total of 12 years. So the state wanted to infuse money in public health to really build up core services. And so they have $10 million they need to get out the door. And so you know, the grant actually is prorated for the months of May and June. So it's like $50,000. And then you start with your first years effective July 1 of 2021 at $300,000. So it has to be regional to apply for the grant, and you have to have at least 3 communities. So we sort of looked around at our partners, and if you go west to Shrewsbury, right, they're part of the alliance in Worcester. So we you know, and then sort of looking. So Southborough is our perfect partner. We share a school district. We have a good working relationship with them. Also, we're with Westboro. Westboro, we obviously do a lot overlap with fire, social worker with our police department. And then we also added in Boylston. We worked, you know, as you guys all know, with Dennis. He's in Boylston. He's been our septic and helped as a health agent doing a lot of our septic inspections over the years. He works in both Boylston and Southborough. So as those 4 communities get together, the meeting was run or coordinated with CMRPC, which is our regional planning agency. We also had Sam Wong attended, and Sam Wong was a previous health director in Hudson and Framingham, and he helped to sort of facilitate the discussion. So we all get together it was Board of Health agents, town administrators and just Board of Health chairs. So Glenn knows more than you guys. So he was sitting in the meeting just to sort of hear about it. So we just talked conceptually about, well, what do we need in our area, right? So DPH wants us to build core services. This isn't a one-off substance abuse grant, or, you know, they want us to build really our core services. So obviously in a pandemic where none of us have a public health nurse, we all said we need nursing services. We really need more help with contact tracing and future COVID vaccine clinics and all of those things, communication with the public and, you know, risk communication. So that's our number one component of the grant. That's the great share of it is, I don't have all the budget numbers, you guys have those, but we're going to look to contract 1.5 nursing positions to, you know, share them specifically with our 4 communities. So they would be housed and really work on shared programming, like expanding Westboro's childhood immunization program to all 4 communities. And also, you know, support with contact tracing. And we're obviously doing regional clinics now, and so building upon that with flu clinics, COVID clinics, whatever the future may hold. That's a number one component, biggest chunk. We also look to increase inspectional services. And so really focusing on food and housing inspections, which are key things. There's also septic, but most of our towns have septic wrapped up, right? Like, you know, so it was interesting with the dynamic of the towns. We share very similar needs and sort of current levels of funding with Southborough. Boylston's probably even less funded. They're only a community of 5,000. Westboro came in and they were great. They're really honest. They said, we don't need staff. We're good. We need nurses, but they really were good on inspectional services. So we put into house an inspector, health inspector, or health agent, increase. So right now we have a line item for a food inspector for $13,000. And that's great, but it's tough to retain somebody for 7 hours a week with no benefit. So this grant would take the town of Northborough's temporary part-time position and take it up to a full-time benefited 32-hour position. And again, all fringe benefits, everything covered by the grant. So there's no additional cost to the town. And so at 32 hours, that inspector would cover the towns of Northborough, Southborough, and Boylston. Boylston's very small. They have very few restaurants. Southborough's, you know, smaller than us, but we have over 100 food permits on a year. I'd have to double check the numbers on Southborough. They're closer to 50 or so, and Boylston's even lower. So that person at 32 hours should be able to keep up with the routine food inspections. They'd be housed out of Northborough. And then the third key component that really pulls this all together is shared inspectional software that I've talked to all of you guys about before. We're already using it for Food Proco, and they have a housing module. The great part about it is I had already sort of was planning to put it in our budget because we need it for this upcoming fiscal year. It costs about $3,600 per user, which is, you know, $1,800 for each of the components, the food and the housing. So it's a big ticket item, you know. So if we wanted to have, you know, 3,600 times me, the health inspector who's part-time, and Katie to be able to add the data and enter it, you know, that ends up being a $10,000 ticket item for a town like ours. So we used the sort of, you know, advantage of scale of economies, and went to our Food Proco and said, you know, we want to quote, give us a bid. We want to get all 4 towns on this. And they really were able to give us some cost savings. So we would all be on the same software. And the great part is the inspection data stays with the town, but our inspector could go to the other town, log into theirs. So everybody keeps their separate data. So the key thing with this grant is, and Glenn was great. He was the great force of saying, we're not giving up our Board of Health. There's no changes to votes or your ability to set, you know, regulation or have your own regs or policies or whatever. It's really just that we're just sharing people, and that we may have shared programming, but all the boards are still intact, right? So there's no, at this time, you know, proposed changes to any of that. It's really just sharing those services. So, you know, it's all like detailed in the documents. And again, we'll know more tomorrow. I'll let you know as soon as we hear. I did hear rumors that only 30 applications were submitted and there were 30 spots available. So I'm hoping, you know,
I like those odds.
Yeah, or odds, look, there was a rumor, but, you know, I know although so many boards of health are very overwhelmed and they just couldn't pull a grant application during all of this planning, but we were able to sneak it in. And a big thanks to our town administrator, John Cordier, who, you know, took a leap of faith. He likes to really vet and know everything inside and out. And we sort of went with it, right? We you don't have all those details figured out in such a short amount of time, but the CMRPC, our regional planning agency, is written in for our first grant year for our first 2 months for an amount of 10,000 to help facilitate all the meetings that would be necessary to get the boards of health together, to have meetings to talk about mutual aid and how would we share these staff positions, and memorandums of, understanding, whatever sort of legal documents would be needed to really make this happen. I don't know if you guys have questions or you just stay tuned, and I'm sure there'll be lots of meetings if that grant award happens, and we'll keep you all.
Do you know what time? Tomorrow?
No,
Now, how do you find out?
I'm
Email?
assuming we'll just see an email. Yeah,
Huh.
that's my guess. Yeah, they said on the 14th because, they're supposed to be awarding the grant 2 weeks later, so there's not really room for them to drag their feet. I guess they have to get the money straight out
That's
the door.
crazy.
Yeah, so it's $300,000 a year, and that's over the 3-year window. So the first term is 3 years.
That's great. Great.
Yeah. So that would transform sort of what we can do right now. I don't know, Katie, I don't have our budget in front of us. The budget for the Northborough Board of Health around what, 200,000 or so, and it would be an influx of 300,000 that would be coming through. Again, some of it's shared, but it would be a big jump.
Krista, what do you see on the horizon as far as another area that this grant would go to? I mean, we've got the food inspection stuff, and we've got the nurse. Is that it? The nurse and the food inspection?
Yeah, it's adding, so you're adding the staff position of the health inspector, which is now more like
Right.
almost full-time, 32 benefit, the 1.5 nursing. And then, there's some flexibility with what we do, right? Economies of scale,
Yeah.
the nurse can build up programs and we'd really go from there. So we'll see where it goes. I mean, a nurse fully benefited, can run you anywhere from $90,000 to 100 and,
Right.
plus when you're talking, so that $300K, I mean, you could get 2 full-time nurses
Yeah.
to eat it all up before you know it. So we're going to have some flexibility where we contract the nursing services like we do now. There's other communities that contract, but they're part of the hiring process, right? They really help to pick out the
Yeah.
nurse, find the individual, and then that person is actually housed here. Our model right now for contracted nursing services is we just get a very small piece of nursing services. Our line items around $7,000 a year to contract with Sam VNA. So we don't get a person, right? I don't have anybody sitting in the office, somebody to do office hours with the senior center or really help to run our flu clinics and work directly with our school nurses, so we're really ramping it up there. So with those 2 positions, when I say 1.5 nursing services, would we try to do some cost savings in the part-time person's 19 hours? If we can't stretch the money, could it be an LPN or, someone maybe not a full RN? So all of that will be part of the discussions with the Board of Health. And, as we put out this contract to one of the nursing services, I think we've had as the town of Northborough, great experience with Sam and VNA. So we're hoping we could work with them through this. But there is, as a Board of Health, we're actually exempt from certain procurement law that would actually allow us that we wouldn't have to go out to bid, the full procurement process because it's under the Board of Health.
Well, let me ask you, if you don't spend the full 300,000,
Yeah.
which sounds like we will, but if you don't, is it going to a coffer for future use?
I think we just get turned back to the state, whatever
goes
we can
back.
use. within the
So it's a
state,
use it or lose it.
And do we have to go through the process every 3 years to apply for the grant again?
I believe so. I think it came out so quickly, they didn't even quite, release how that would all work. It's just that it's a 3-year term, and they're looking, I mean, the DPH and everybody knows the problem is you do these grants and they come and then they go and then,
Yeah.
so many people don't want to do it because we know it's not going to be there. So, I mean, they really are trying to promise and say that this is going to be, they want to see us build and work on these regional service plans.
Huh. Well, I haven't had any further questions. Anybody else?
No.
No?
Okay.
Do we have any? What else we got? Anything?
Yeah, so in the big ticket item here is, I'm going to read the agenda here. It's actually a vote to determine lifeguard requirements at semi-private schools. And so I don't know, well, I know the pool regs that we follow. We don't have our own regulation on pools. We follow state and Massachusetts regulation on pools. We permit them. We're required, like all towns, that we have to permit them each year. Katie sort of pulled together some of the summary. I haven't been here long enough to know all the pools, but we do have 2 right now that have sort of came back to us. And they've said, well, do we have to hire a lifeguard this summer? So what I told everybody is last summer was wild. We didn't have a health agent. I don't, a lot of them weren't open or they weren't allowed and there were rules. But, there are very clear rules under COVID now on pools and the occupancy and all of that. But really, at the end of the day, the requirement on lifeguard isn't a COVID rule. It's a Board of Health. We're responsible for permitting them. Falls under the state of Massachusetts, pool standards. And it says under a lifeguard at semi-private pools, it's at the discretion of the Board of Health as to whether or not a lifeguard's required. So I've asked around with some of my colleagues, and I said to Katie, like, what's the precedent? What have we typically done here in Northborough? And Katie, do you want to provide a bit of a just summary how many pools we have in town and which ones we're talking about permitting and maybe making this decision on this year?
So typically we have 4 pools that we permit every year. They're North Court. That's one of the pools that they're the ones that wrote us a letter voicing some of their concerns. Northborough Manor Condo Association, they did not open their pool last year and they are not opening it this year due to COVID concerns, but previously they did have lifeguards. Teamworks is one of the other pools. They always have lifeguards. I don't think that's going to be an issue at all. The only other one is Avalon, the apartments. It looks like last year, Casey allowed them to have no lifeguard on duty as long as they had an attendant that was there during the day in case of emergency. And they were limiting to like 10 bathers at a time and 10 chairs, and everything was by appointment. So they're the other ones that it looks like they might be in that same situation this year. It looks like they outsourced their lifeguards, and last year they couldn't get them to travel here. So that was one of their issues. So I think that's all of them. Yeah. So North Court and Avalon are the ones that are, hoping to not have a requirement for lifeguards.
And that's why I bring this to you, because it's a big choice, right? It's a safety issue. I know we're at lower occupancy this year, so yeah, that may sway you. I'm worried a little bit about the liability. We're the ones permitting it and saying it's okay and it's safe. And ultimately, it's a Board of Health decision. So on the agenda here, we actually had officially listed as a vote to determine, at least for these schools this year.
They have attendants, but not certified lifeguards.
Avalon, that's Avalon. Yeah, they have somebody that watches the pool area. That's at least what he submitted today as their plan, was that they would be posting something that says no lifeguard on duty, and during the day they would have an attendant there just in case of some sort of situation arose.
And the other one doesn't even require an attendant?
They're the ones that sent the letter. So it looks like in previous years they did have lifeguards because they offer swim lessons and testing the pool chemicals and all that. Yeah. But they are concerned this year that having another person would provide a possible exposure to COVID if they don't know where that person's been.
Like a lifeguard?
Yeah.
Is that what they're saying? That the lifeguard could have COVID?
They wrote a letter. That's the one we sent over earlier.
Yeah.
That was the letter.
Okay.
So I just, I talked to about 4 colleagues about this and what have you typically done? You could do more research. Most of them said we require lifeguards at pools. It's ultimately up to the board's decision. Talking about, I want to throw last year aside because you didn't have a health agent here. Casey left in March. I don't know what, that was Casey. I don't have any documentation unless you guys remember that was an official vote of the Board of Health about a lifeguard or not a lifeguard. So, I want to really make sure we all sort of look at this with a clean slate. I mean, Teamworks is no question. They're running camps. It's a high, Teamworks is not a concern. it sounds like the Northborough Manor is not a concern because they're not opening. So we really have two situations, which is the Avalon Apartments and the North Court that are requesting not to have it. But historically, Katie, did both of those pools submit in prior licensing, COVID last year aside? Did they have lifeguards in prior years?
Yeah, I believe so. I mean, a North Court's letter says that they weren't required to, but that they chose to. But I know Avalon always submitted lifeguard certifications with their applications. So as far as I know, they always had lifeguards at Avalon as well.
I mean, clearly I'm not familiar with the two pools, the physical aspects of the pools.
Mm-hmm.
And I know you can drown in an inch of water, but are they diving board, Olympic sized pool, diving board, that whole thing? Or do we know? Is there a deep
I'm
end?
not sure. I haven't actually been to any of them.
Yeah.
I was a member at the North Court a few years ago.
All right.
There is a deep end. I'm just worried about not having a lifeguard there because it is so secluded. So if you see what I'm getting at, it is in a, it is out close to the woods, and in case there is an emergency,
Right.
I worry about what could happen. Kids running around, or gone to the pool without parents knowing. So.
Yeah, because in the letter they do mention that the parents have to be supervising the children; they should not be left unattended, et cetera, et cetera.
Right.
But we all know how that works.
Right.
And
if there's no one there that knows CPR and you got a problem,
Yeah.
Exactly.
And you got
Exactly.
a 17-year-old attendant not paying attention, so to speak, you got a problem.
Yep.
Well, being a lifeguard back in the day,
Okay.
I'm well trained in the necessity and usefulness of a lifeguard, a certified lifeguard. And so I have no issue with requiring a lifeguard to be present at any pool, in Northborough. Yeah. There's no qualms about it. I don't see why you wouldn't have a lifeguard. It doesn't make sense to have a pool without a lifeguard.
Yeah, it's a cost issue. That's all it is, right? From their standpoint. But everything else, there's no reason not to have a lifeguard.
Right. And we didn't make a lot of money back in my day. We didn't make a lot of money as a lifeguard. I still don't think they make a lot of money as lifeguards, quite frankly.
I agree.
An attendant gets X amount of dollars. A lifeguard
Gets a little bit more.
Yeah.
A little bit more.
Yeah. Having an extra set of eyes on the kids is, needed.
Right. Yeah, a lifeguard works to be a lifeguard. I mean, as opposed to an attendant.
Yeah.
Nothing against attendants, but
right.
All right. Well,
I mean, they're in a uniform. Kids will pay a little bit more attention to somebody that's in a uniform as opposed to an attendant who's walking around.
Right.
A
lifeguard gets a whistle.
Yeah. There's some little bit of authority there, right?
Right. Now, I have no problem with requiring it. I don't see any downside to it. So what do? We got to take a vote. What happened to Katie? I mean, Kristen.
Oh, I'm here.
Okay.
Yeah, go for it. Yeah.
All right.
Someone make a motion.
I need someone to. What's the wording? I'd like to entertain someone to entertain making a motion.
So you want me to do it?
Why not?
All right. I make a motion that we require, the town of Northborough Board of Health requires all, private pools?
Yeah, semi-private, all public and, hold on, public and semi-private.
Public and semi-private swimming pools to have a certified lifeguard on site when they are open.
Is that Red Cross certified? Is that who it is?
Yes.
Usually they are Red Cross certified. Yes.
Okay, then I would say Red Cross certified lifeguard on site when they are open.
Yes.
Okay, Dr. James made the motion. Dr. Sane, care to second that?
Yes, I do second that.
Okay, all those in favor?
You're gonna do a roll call.
Okay, Dr. James in favor. He made the motion.
Yes.
Dr. Sane, you're in favor and I'm in favor. Therefore, it's passed.
Okay.
This is
All right.
official. It's official.
I think we just have next on the agenda, Katie Wright, is to send a tentative meeting date.
May 11th, I think it was.
Yeah,
Yep.
May 11th, the Tuesday, the May 11th.
Very good. All right. Great. Good meeting.
Okay. So
Wonderful.
we'll be in touch, and I'll let you know as soon as we hear about that grant.
Tomorrow. I
All
won't be
right.
able to sleep
Yeah,
tonight.
I hope.
We'll be up all night. It is
Kristen,
exciting.
in terms of,
Congratulations, Kate. Kristen. Done very well. Okay, everybody, thank you very much.
Thank you.
I'm gonna go watch
need
the
to-
Western.
You want
You need
a
a
motion to
motion.
close or adjourn
Oh
the
yeah, we
meeting?
gotta close the meeting. I move that we not terminate the meeting. What is it?
Adjourn.
Adjourn the meeting. Thank you very much.
I second it.
All those in favor?
Hi.
Aye.
Perfect. Good night, all.
Good night, everybody. Thank
Bye
you.
now. See you next
Thank
month.
you. Kristen?
Yes.
Yeah, a quick question regarding the clinics. In terms of volunteering, is there a website, like, is there a link where, because I've had a few people ask me about it.